Topping the news at 5:30, University of Buffalo School of Nursing is creating a state-of-the-art $34 million nursing simulation center.
We're joined now by Annette Wysocki, the Dean of UB School of Nursing, to talk more about this major announcement. Thank you so much for joining us. This is SUNY's first nursing simulation center of excellence. What will it include?
It's going to include a lot of innovative new technology, and that will include everything from telepresence robots to virtual reality to also immersion rooms there'll be projections around the room for people to be totally immersed in an atmosphere to teach them contemporary skills that they need to meet the challenges to care for patients in the workforce. And our simulation center will be not only for UB, but will be the only SUNY system-wide nursing center of simulation excellence. So we'll also be working to educate faculty and students from across the SUNY system in all these new tools and technology that we can use to help them improve clinical judgment.
That's great. I mean, we're seeing advancements all over the place, all over the world in all kinds of different industries, but we're really seeing a lot of advancements in the medical industry with the introduction of AI and all these different new digital and I'm thinking of robotic surgery. There's so much new stuff going on. This is you guys kind of not catching up to it, but being on the front edge of that research and of the capabilities for these nurses.
No, absolutely. And I mean, we really look forward to being innovators in this space, to creating those, not just being users and consumers, but to be creators of the new technology as it moves forward. And we also want to engage in testing the new technology as it's being developed.
Because this is so new that some of it hasn't been, fully, not vetted, but fully run through? What would you say?
No, exactly, and especially around some of the artificial intelligence that Dr. Kelly Volz-Ramos is working on, using artificial intelligence and how to create that to make that also part of this experience. But it needs to be tested and used and to make sure that it's being used responsibly.
UB already uses simulation programs. You already offer that. How will this help even further? And why are you adding more? Obviously, it's working for you guys.
No, it actually improves clinical judgment so much in what we do today with new therapies that are being developed, which create challenges that we haven't had to worry about before. So what this does is it allows people to have better situational awareness and exercise better clinical judgment that we can help them work through so that when they're actually in the situation, they know what to do.
This has to make UB, once it's finished, a pretty premier place to learn about nursing. I mean, does this really elevate a school of nursing that, quite frankly, is already one of the premier in this state?
Yes, no, it will certainly put us on the map nationally, and especially in conjunction with the Empire AI initiative going on at UB. So we look forward to being the leaders in the nation.
Let's talk about enrollment. You guys have facts and figures that you believe this will help enrollment. What are some of those facts and figures?
So what we're planning to do is we will be expanding our enrollment by at least a third over the next decade, and we hope to be even more aggressive than that and really almost double the numbers of students we have at the undergraduate level, again, to meet the workforce demands, knowing that there's projected to be ongoing demands for that in New York State. And I know the governor wants to increase the nursing workforce among SUNY schools by at least 20%. So we are the engines to help make that happen in partnership with SUNY and the governor.
What is the current workforce like in terms of nursing? Are there more nurses than needed? I'm assuming there are probably a lot less than are needed, right?
Yes, so right now in New York State, there's an ongoing need for nurses in the workforce. We've made some strides in certain places, but there's still pockets where there's an less than are needed in the workplace.
Yeah, and we were actually just talking today that some of our biggest employers here in Western New York are our local hospitals and healthcare industries. So it would be nice, I'm sure, for you guys to get local students and then stay local.
Yes, I mean, we're always striving to do that and working to recruit people here, but we do have also students that come from across New York State just because the reputation of our school. And I know this past year we had a 100% pass rate for our national licensing exam for both our accelerated as well as our traditional students.
Wow.
So that's made us a real beacon of people wanting to come to UB.
That's tremendous. All right, so let's talk logistics for this $34 million project. When do shovels hit the earth? Has there already been work done? And when can folks expect to see it complete?
Yes, we've already been working with Kelly Hayes McAloney, who's our campus architect, to draft up some, very crude plans that were part of our proposal, and they will be working with that team to finish and finalize the design of that. And then we're hoping to begin, as we will be meeting with SUNY, of course, to understand what their timelines are, but we look forward to having this done in 3 years.
Great.
Okay.
Wow.
Annette Wysocki, thank you so much for joining us.
Thank you.
Congrats.
Congratulations.
This is
Thank you.
amazing.
Big.
It is.
Thank you.
It's really big.